In pediatric neurosurgery, like we do at Children's Hospital, we deal with a lot of congenital issues. For example, the average person makes about 300 cc's of spinal fluid every single day in the middle of their brain. That fluid percolates out through a very complex series of passageways and exits the brain, circulates to the top of the brain, and is reabsorbed back into the bloodstream continuously every day. You can imagine that you'd have trouble if that drainage were blocked along its pathway, such that the CSF is still made at this phenomenal rate, but the ability for it to absorb is diminished or even cut off completely. That process results in pressure and accumulation of fluid. It's called hydrocephalus. And that's a perfect example of the evolution of neurosurgery. In the late 50s, a new device called a shunt was developed, which was essentially a valve-regulated tube that could drain the fluid out of the head and into another site, for example, the abdomen. So anytime the pressure built up to a certain point, the valve would open, the door would open, and the fluid would drain until pressures were normal again. We now have taken the endoscope, which we were mentioning, and have found that on certain types of hydrocephalus, you can actually bypass a block within the brain by generating a new outlet for the fluid to escape from the inside of the brain to the surface of the brain. By doing this in the appropriate patient, you have cure rates of the hydrocephalus in excess of 80% permanently. That's a wonderful step forward. Shunts are a fantastic step forward, but they're a mechanical device. Imagine the wear and tear you're placing on a small, soft, biocompatible device that has to deal with 300 cc's a day constantly. In contrast, with the endoscope in the appropriate patient, you've essentially cured that patient for life.